to Beyond the Couch OT Stories. I am Wendy, and I have two guest speakers today, and I'm going to let them introduce themselves.
My name is Tamisha Williams, and I'm a student.
I'm Dee, the OT, and I have 12 years of experience.
Okay, and today I have a topic, and it is rehabilitation to optimal performance, the crucial role of occupational therapy in sports rehabilitation. So, I guess my first question is, do you have any experience on working with anybody who had a sports-related injury?
Well, not personally per se working with clients with sports injuries, but I have worked on individuals with sports injuries. I just use the skills that I've granted with that I've learned with them out in the field. Like an example, my old man, he had a sports injury. He was playing soccer, and I noticed something was wrong. So I believe he either bruised his rib along with twisted his ankle. So I just happened to have some ibuprofen on me. So I utilized that with him, especially with the pain that he was having in his chest because he said he was having a difficult time breathing. And then I utilized some instant cold packs that are in the first aid kit and just wrapped that around there. I didn't have an ace bandage, but I had a sock. So as OTs, we adapt, think outside the box. I utilized that. Iced him up and told him he needed to compress it. Now, did he follow up with the doctor afterwards? No, he did not. So, he may not fully recover to his best potential or have within functional limits for his ankle dorsiflexion or eversion and things like that. But that's a choice that he decided not to do.
And I am constantly being asked by my family members, my daughter, my son, my husband, this, that, or the other, and whether it be kinesio taping. So I guess back to your original question. I mostly treat older adults, so mine are more like fall related, maybe pickleball related. But for the most part, no. But families, yes. We families think that we know it all. I mean, and as moms, we kind of do know it all, right? I mean, at least we can fake it, as moms do. But yeah, my knowledge has been very vital. When my husband had a brain injury, and just having to help watch out for signs of what to look out for and what precautions to be aware of, so that like his injury when he was hit by a car, it wasn't more severe than what it could be per se.
Well, I have a funny story. I feel so silly, but I guess we can call this a sports injury. I was playing a sport, wall ball. Now, if you're not familiar with wall ball, it's when you take a tennis ball and you kind of throw it up against the wall and you're playing with other people. And you say a little couple of things. Wall ball, no relay, no drops, no stuff, no hands off. Well, I go and I dive for the ball. And I heard a noise right in my thumb, my right thumb. And I was like, oh, that kind of hurts. And it was discolored. And so I'm like, it's okay. Well, at that time I was working out. So I'm like, it's okay. But I couldn't do a push up. I couldn't do a lot of things. I was like, oh my God, I really injured my hand. So I left my workout, went to a former nursing home that I worked at. And I was like, hey, what do y'all think about my thumb? At this time, now my thumb is purple. Within an hour and a half, they're like, wow, you might want to go get that checked. So I went and had an x-ray. And so I noticed that I chipped a little small portion off the inner aspect of my thumb. It was just kind of floating in the air. But for it to be such it was like a centimeter of a chip or a half a centimeter to cause so much discoloration, it was disbelief. So I had to wear a splint, like an immobilizer for that. I had to ice it. It was an inconvenience because it was on my dominant hand. And I did not realize how much I utilized, especially my thumb, for everything. And when you injure something, what happens? You continue to re-injure that same item.
Yeah.
And I was down for like 3 weeks with it.
Yeah, you don't realize how much you need something until you
Yeah.
can't use it.
And I followed up with the doctor or an orthopedic, and they gave me some not over the counter, some prescribed prescription. But at the same time, there was nothing they could really do for me. I could have saved my coins with that. So I just managed to utilize some equipment that we have at home. I have like a TENS unit for pain management, and I just did some range of motion activities with the kids' Play-Doh and things like that. So I guess, if we want to say that's a sports related injury, we can utilize that. Okay.
What about you? I think you were
Yeah.
active, right?
Yes, I was an athlete for 4 years. I know elementary doesn't really count,
It
but
counts.
luckily, I think the only thing I ever had was a Charlie horse in 7th grade.
Ooh.
So I haven't really experienced any type of like injury that kind of put me out of the season.
Okay.
But what really got me into wanting to know about what we could do was I had a teammate. She was going up for the ball in basketball, and I guess she landed wrong when she, um, I guess I don't know if she hit another person or she just landed wrong when she was trying to grab the rebound. But her knee, you can see it kind of twist out of place, and you can hear her when she just screamed really loud in the gym. And I mean, I know most of the time we hear about other clinicians who will help this, but I was just wondering, like, would there be something that we could do if she were to come into our clinic as well to help her?
Mm. Well, definitely with that, she needs to follow up with her primary care physician. They'll refer her to a specialist or maybe an orthotic or something like that.
Definitely want to get x-rays done to make sure that there's no underlying bone and it's muscular. Definitely ice, rest, compression, elevation, ice.
I know there's another one called Price. I don't know if you're familiar with that. So the P in is like positioning. I was like, oh, that's new because
Okay.
we were
Yeah.
learning about that
Yeah.
and things like that. So definitely will follow the regimen of that. Now, say for instance, it interferes with her everyday activities. So think about anything and everything you do. If she, at that time she was a student, right?
Mhm.
So she has to get up and get dressed, shower, use the restroom, put her lashes on. I don't know, comb her hair, brush her teeth, make her lunch. Now, with that injury, she was not able to do that. She has to use a different technique to roll in and out the bed to get in and out and do these different activities. So we can give her the tools to be successful. Maybe she'll need her parent or her sibling to help her with different activities. So that way, we consider that kind of like modified independence or assistance just because she's not able to do that task. So definitely would want her to continue on with her daily regimen, but modified because we don't want her to re-injure herself. Because I know, because I am one of those individuals that I don't really take time to rest because we're always needing as a mom. And she probably didn't rest. The coach was like, hey, you need to sit down, but you still need to be present for, these sessions, y'all powwows and the team meetings. And she needed to be there for when y'all practice and things like that so she wouldn't miss a beat. Do you recall, did she follow the protocol? Did she stay off or rest for the time that they requested her to stay off?
Um, I don't think so. I'm from a little town in Arkansas, so she's one of the top 5 girls that played on the gym.
Well,
So the coaches like ice it.
Oh Lord,
Go
coach.
home, ice it, kind of massage it, and she would put her in the weight room. It's like,
Be back
okay, you
tomorrow.
exercise it. Even though, and I think when at the end of the day she had to go and get X-rays, and I think it was like she had extra fluid or something that was in
that's
there,
easy.
and
Yeah.
I know it was inflamed a lot, and I know she ended up having to wear a knee brace, but it got to a point where when we played, she couldn't stay on the court long due to the stress on her knee and due to her not being able to go out there and do what she wanted to do because she couldn't jump up like she could anymore.
Oh, no rebounds, none of that. And I know we know it's like full court press, right? Y'all doing all. And what was her position in basketball?
Post.
Oh, post. So she's down in the post.
Yeah,
She's
so-
like, oh man.
Yeah, so that affected her ability to be able to turn her body around because if not, she would always do something with her knee when she would rotate it. And so it would, she couldn't really do the exact same things that she wanted to do.
Do you still talk to her these days?
I talked to her maybe a couple years ago.
Okay.
But,
did she go to college
she did.
on sports scholarship? Yeah.
You did. I think you did 2 years.
Oh, 2 years. Okay, well that's good. But at the same time, she found out through that process of when she should have been healing that she injured it and made it worse. Shame on the coach, but I get it. There must have been pressure there. But also, her parents needed to advocate for her and say,
Well,
"Hey,
her parents are just saying this is her way to college.
yeah." But at the same time, but a
They
lot of
but
kids get to college and then they're out the first semester. Now, I don't know if they get to keep that scholarship or whatnot.
not normally. They
Well,
lose it.
see, and I understand, but is she playing professional ball like
No.
Very
WNBA
few.
or international? So, like, she could have been that stellar star and play for the WNBA because we need more representation of us
Yeah.
because we're just as good as the men. Anyways,
Don't
but
get off topic.
I'm sorry, but we are better than men. But anyways, okay, good question. What else you got for us?
For one, I just wonder why there are things that we can do to help people
Mhm.
with sports related injuries, but why is it not more of us represented in this type of field?
I'm assuming that's more of a preference by these careers and these businesses because they feel like certain, which I'm trying not to say the discipline, but they feel like that discipline can do our work. Okay, which we are holistic, and I mean occupational therapists. We treat them from head to toe, mind, body, and soul, and things like that. But that goes to show not a lot of people know what we can do, what we're able to do. And I feel like they look for individuals who have a degree in sports medicine and
Mm-hmm.
physical therapy because like
Kinesiology.
oh yeah, sorry, kinesiology. They feel like, well, they know the body the best. They know how everything moves, the levers and this that. We learned that as well. But I don't think anybody wants to give us an opportunity to show that we are strong. They don't believe in us. They don't feel like we're as smart as them and
Or
things
do
like
you
that.
feel like it's our profession has not advocated enough for us for the payer sources that has maybe not let us have a seat at the table?
Oh, they're not ready for that because when we come in as OTs, we come in, we're thinking outside of the box. We're trying to teach those, allow them to lead and be successful in their areas independently or with modified independence. So that's a good question. Maybe one of us will be brave enough or bold enough and apply for a position like that and
Maybe
see what
that's something
happens.
you can do.
Yeah, I was
Yeah.
thinking about it, but reading up on it, I seen you have to go a little bit higher, have to have at least a bachelor's or a master's
Okay.
in this field to even be considered doing something like that. So it's
Mm-hmm.
something that I have looked up and I researched, found articles about it, and all it said just talked about how it just lacked, this support going into this type of field. And
I love
yes,
it.
people do it, but they lack the support. Like you said, getting having people giving them the chance to like to go in and actually showcase like what they can do and what we
Mm-hmm.
actually do.
Well, and you can look at there's not any occupational therapy trainers.
You're
There's
right.
not any occupational therapy out clinics. It's always physical therapy or speech therapy. So I think that if that's something that you would be interested in, you would definitely be a groundbreaker for our profession in getting out there. But then the problem lies is, would insurance slash Medicare, Medicaid be willing to pay for that service through you?
Exactly. And I know that we have to have a script written by the MD and things like that for
Yeah.
us to even initiate looking or even touching the patient and things like that.
Mm-hmm.
So that could be an obstacle. I feel like those who may haven't. I knew one outpatient clinic that was OT. She's no longer in business now, but she had a lot of trials and tribulations trying to keep an MD on in housing her staff because she had a lot of clients there and they were there for different things like mommy makeovers, some sensory processing things, ligaments issues or hand like just
Pelvic floor.
oh thank you pelvic floor and things like that. So she thrived in that area, but I don't feel like I'm not quite sure what happened, but she
Well, I'm
wasn't.
sure probably COVID.
Well,
COVID didn't help a lot of
uh,
businesses.
COVID. Let's not even talk about COVID, but she wasn't able to continue on. Now I know she had that establishment for at least 6 years, and then I'm just thinking the money management aspect of it went south, and so she wasn't able to stay afloat. So that was one of the OT clinics that I'm aware of.
Mm.
Okay, what
Okay.
else we got?
Good. Um, I was just thinking about when an athlete have an injury
Mm-hmm.
and thinking about them holistically,
Mm-hmm.
mentally and physically. What can we do to help them with their fear of re-injury?
Ooh, that's a good one, Dr.
Let's turn
Heidi.
that back on you.
Oh, what are some
What
things
do
that
you
you learned in
think?
class?
I mean, I know first thing if I like just thinking back to my friend, um, having her injury, that was the biggest thing. Like going to college, like that's what she liked to do. She loved to play basketball, and I remember kind of talking to her about it. That's what really got me into like going just into therapy in general. Was like, okay, well, how do you feel? What do you want to do? Do you feel like you want to quit? Do you feel like can you keep going?
Uh huh.
What can you do to keep going? What can I do to help you keep going? Because I mean, I wasn't one of the best, but I always like to support them to help them whatever was needed for the team because that's what it was all about, the teamwork.
Yeah.
And so I feel like as an occupational therapist, from what I've learned, and one thing is keeping them motivated and keeping their mindset up, and then helping them to realize and to feel like I do matter, that I can keep going, that I don't have to quit. Yeah, I have an injury, but that's not gonna stop me.
Yeah, that sounds
Well, and
good.
I think that's very vital. I think also you have to realize that trauma plays a big part in the PTSD, the mental aspect of it. Because if I go out there and I'm in a similar situation, what's going to come straight back to her? That injury. And so you also have to address the mental aspect of it in addition to, the for her specifically, but individuals as a whole, I think.
Okay. Definitely would say a lot of self care, self reflection, positive self talk, if that's your jam. um, Changing like your mindset from saying I should to I can, I will. And then also stepping outside, taking in that vitamin D. Do something healthy for yourself, or go exercise. 15 minutes, 30 minutes a day could help with that as well. And you don't have to sweat. Just something. Change up the scenery. Do something meaningful, whatever that may look like to you. Okay, if you're a journaler, go ahead. Just keep um, just say whatever you got to say on that paper, or put in a recorder and just get it off your mind. And just I don't know, there's so many ways to do it. Tai Chi is another thing that you can do. Progressive muscle relaxation. So there's a lot of things that you could work on with your clients. It all depends on what they like. And you have to
Right.
try a lot of different things until you find something that you really enjoy.
And I think that that's what makes us a valuable resource to this profession, in that we can provide a holistic approach to situations like this, and help individuals look at their mental health, their physical health, all of that good stuff.
What about a person who was an athlete that has went into retirement,
Mm.
and you've got them? I mean, some of them, if they had like a significant decline,
Mm-hmm.
like I forgot what the word is. It's almost like they know they want, they know that they was an athlete, but they feel like there's nothing else in the world for them to do.
Oh, well, definitely we have some assessments that we can help them assess the possible leisure activities.
What about some
Person.
peer mentorship? Maybe mentoring up and coming, individuals, and like if they're active in sports, what about mentoring some of those individuals and help give them different strategies that can help them be successful?
Well, that sounds good, but the only thing is like like the rules change with the game. Like I had no idea when they do play football that they can no longer do the celebration dances for a set amount of time. I had no idea.
Oh, that's been a rule for a long time.
Well, look, I didn't know. Okay, I didn't know. So, like, if you had someone who played basketball back in the '70s versus now, the rules have changed. So the mentorship is good if they're aware of how the game is being played, or also, have them go out to what is it, UIL, whatever, rec ball, things like that. Get them out the house. Let them go and be around people who play the game, and then they can be like a sideline coach, or like maybe they can do something with the kids and things like that. Oh yeah, that's a good thing. That's possible. Do you know anybody who has a decline because they're no longer active? Or maybe they can make a video game. Don't they use old players and things like that to make video games?
Okay, we don't use the word old players.
Okay, retired players.
Thank
I
you.
apologize.
Thank you.
I'm not gonna say mature because that's a different thing, but
I
retired.
don't think I know. I don't know anybody that's like that because a lot of them. I mean, you have the ones that I always talk about, like the glory days. That
See,
like I had a
Yes,
like I had,
exactly.
yeah, I have an uncle who was really good in football,
Okay.
but he had an injury that happened in his knee or something, and so it kind of retired him early. Like he couldn't go to college to play, so he had to find something
Something
totally
else to do.
different from athletic ability to pertain on.
Well, and I think that, in thinking about occupational therapy, that's where we're holistic in that maybe we can add in this spirituality if they have that aspect in that, okay, maybe that this is something that you're not meant to do. Let's find what you are meant to do now. I mean, we can definitely advocate for that. Something to think about.
So what do you do if that person's like bitter?
That's a matter of working, helping process the feelings that, um, you know, um, of woulda, coulda, shouldas. All of our lives are not the way that we anticipate them to be. Growing up, we have all of these dreams, or a lot of us have dreams and expectations of I'm going to grow up and this and this and this is going to happen, and then things happen and it goes all haywire. So what are you going to do at that point in time? I mean, you can have a pity party for one, is what I like to tell my patients, or you can suck it up, buttercup, and you can figure out where you're going to go from here. So, I mean, and it's a matter of exploring the options that they have, you know.
Yeah. Now I still work with clients or patients who happen to be bitter, so I come in there very chipper and things like that. And I just try my best. If I'm not able to put a smile on their face or anything like that, I ask them, like, what are things that you enjoy? So then we can focus on those things and hopefully it elevates their mood. And then we can piggyback to their glory days or talk about what's going on in the season, or maybe they have a favorite team. And you can just talk about, well, how do you think they're doing? How are they performing? Their stats? What do you think about the coach? Just anything because once you get them talking about it, then hopefully their mood changes. And then once again, maybe change them from that environment. Take them outside and talk about it. Take them to the courts, watch, and things like that. Or watch like a show or a movie that has sports in there. Even like look at the Olympics. That could be an option, and they can tell you how, if they were in that position, how they would play that position and things like that. So those are different ways. Now, we have to trial and error. It might not work, but just continue to be consistent with that. You maybe have some gains. Okay.
Okay.
What else you got for us?
That's really all of my questions. To be honest, I'm kind of glad that I was able to talk to you all about this because I've asked out in the field. Do you know anybody who's an occupational therapist and they do something in the sports field? And so like just listening to y'all to kind of give like a little bit of hope to know like there is something that you can do, even though somebody may not give you opportunity. I always hear it's not about what you know, but it's about who you know.
Yeah.
Absolutely. That is vital to everything. And, you can even go out and create. In school, you've been taught to create businesses. Go out and find somebody who will finance this business and you create this business. I mean, that's something that, and I would also encourage you and definitely all of our listeners to really invest in the state level and support your state and your national board to help us promote our profession. When you're staying involved at the state and national level, that's how we're going to get more funding and they're going to advocate for us. And so I think that's of vital importance to us. So I would highly recommend that. Maybe we can come back to you and you can tell us about your business that you started in a few years.
Maybe.
Coming with you. Okay, well, it was such a pleasure having us on. Thank you, Whitney. And we look forward to continuing on.
Yeah, if you have any questions, comments, concerns, please definitely reach out, or any other topics you'd like to hear on the podcast. We greatly appreciate it. Thank you.